Did you know that ginger, a globally celebrated health booster, can be extremely dangerous for some people? Yes, you heard it right. Ginger, the fiery root with its signature zest, is appreciated worldwide, not just for its distinctive taste, but also for its vast array of health benefits. From livening up a dish to soothing a troubled tummy, ginger is a powerhouse in both the kitchen and the medicine cabinet. But, as with all good things, there's a flip side. Despite ginger's many accolades, it's not always the go-to remedy for everyone. In fact, in certain situations, it can do more harm than good. From bleeding disorders and diabetes to heart conditions and pregnancy, there are times when ginger should be approached with caution. So, how do we know when to embrace ginger and when to avoid it? In this video, we will delve into the 9 circumstances under which ginger should be avoided. But before we dive in, do us a favor. If you're interested in health and longevity, hit that like button and subscribe to our channel. We bring you scientifically researched health content daily. You have nothing to lose, just a wealth of knowledge to gain. First on the list is bleeding disorders. One of the lesser-known properties of ginger is its ability to interfere with blood clotting. This might sound alarming, and for individuals with bleeding disorders, it can indeed pose a significant risk. The biological mechanism behind this involves a compound found in ginger called salicylate. This is a natural blood thinner, much like aspirin, a medication often used to prevent blood clots. While this can be beneficial in certain circumstances for those with bleeding disorders, it could exacerbate their condition. Research studies have lent credence to this claim. A study published in the Journal of Ethnopharmacology found that ginger has an inhibitory effect on platelet aggregation. In simpler terms, it prevents blood cells from sticking together and forming clots. Now, while this might be beneficial in preventing conditions like heart attacks and strokes, for individuals with bleeding disorders, it's a different story. Bleeding disorders are conditions that affect the way your blood clots. When you get a cut or a bruise, your body naturally forms clots to stop the bleeding. However, in people with these disorders, this clotting process doesn't work as it should. This can lead to excessive bleeding and bruising, which can be life-threatening in severe cases. So, imagine combining a substance that inhibits clotting with a body that already struggles to form clots. It's like adding fuel to the fire. The result could be prolonged bleeding times and even spontaneous bleeding in severe cases. This is why for individuals with bleeding disorders such as hemophilia or von Willebrand disease, consuming ginger could be extremely risky. And it's not just fresh ginger root we're talking about here. This warning extends to all forms of ginger, including dried spices, supplements, and even ginger-infused foods and beverages. So, if you have a bleeding disorder, it's best to steer clear of ginger. Always remember, what's beneficial for one may not be suitable for all. And when it comes to health, it's always better to err on the side of caution. Next, let's talk about diabetes. It's a condition that affects millions of people worldwide, characterized by high blood sugar levels. Diabetes management is a delicate balance, and it's crucial to understand how different foods and spices, including ginger, can impact this equilibrium. Ginger is often praised for its potential in reducing blood sugar levels, which may sound like a boon for those with diabetes. However, this is where the situation gets a bit complicated. While managing blood sugar levels is vital for those with diabetes, drastic or sudden changes can be equally problematic. Research suggests that ginger can lower blood sugar levels, but it can sometimes do this a little too well. When consumed in large quantities, ginger might lower blood sugar levels more than desired, leading to hypoglycemia. Hypoglycemia, or low blood sugar, can cause symptoms such as dizziness, shakiness, confusion, and in severe cases it can lead to unconsciousness or seizures. Furthermore, if you're taking medications to manage your diabetes, adding ginger to the mix could potentially amplify the effects of these drugs, again increasing the risk of hypoglycemia. Therefore, it's crucial to be aware of the potential interactions between ginger and diabetes medications. For instance, ginger might interact with insulin, sulfonylureas, and other types of diabetes medications. These interactions could potentially enhance the blood sugar-lowering effects of these drugs, leading to an increased risk of hypoglycemia. It's important to note that everyone's body responds differently to foods and spices, and what might cause a significant drop in blood sugar levels in one person might not have the same effect in another. But in the context of diabetes, where maintaining stable blood sugar levels is essential, it's better to err on the side of caution. In conclusion, while ginger has many health benefits, its potential effects on blood sugar levels, can be a cause for concern for individuals with diabetes. If you have diabetes, it's always a good idea to talk with your healthcare provider before making significant changes to your diet, including adding new spices like ginger. Next up, at number 3, gallbladder issues are another concern. If you've ever experienced the pain of gallstones, you know it's something you'd rather avoid. But what does that have to do with ginger? Well, ginger is known to stimulate the production of bile in your body. While this is generally good for digestion, for those with gallstones, it can lead to complications. Gallstones are hard deposits that form in your gallbladder. They can be as tiny as a grain of sand or as large as an apricot. If you have gallstones, extra bile being produced can potentially lead to your gallstones moving, causing blockages and intense pain. While ginger has many health benefits, if you're dealing with gallbladder issues, you might want to think twice before adding it to your diet. Remember, it's always important to talk to your healthcare provider about your diet, especially if you have existing health conditions. Moving on to number 4. Heart conditions also necessitate caution with ginger. Let's delve a little deeper into this. Ginger is known to interact with certain heart medications. It's like a well-intentioned friend who sometimes causes a bit of trouble. For instance, ginger can have an effect on anticoagulant drugs, which are used to prevent blood clots. It can potentially increase the risk of bleeding by making platelets less sticky. Now let's add another layer to this. Ginger can potentially increase your heart rate. This could be concerning for those with heart conditions, especially those with irregular heart rhythms. Imagine your heart is like a drummer in a band. It needs to keep a steady beat for the entire body to function in harmony. When ginger steps in, it could be like a band member playing out of sync, disrupting the rhythm. So, if you have a heart condition, ginger may not be your friend. Enjoying our video so far? Before we move on to the next one, don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative videos. Next, at number 5, medication interactions are a significant consideration. Ginger, while a healthful powerhouse in many instances, can also interact unfavorably with certain medications. This is due to the potent compounds it contains, which can interfere with the way our bodies process these medications. For instance, ginger has blood-thinning properties, which can be a concern if you're taking anticoagulant or antiplatelet medications. Here, ginger's influence may amplify the effects of these drugs, leading to an increased risk of bleeding. Additionally, ginger can lower blood sugar levels and blood pressure. So, if you're on medication for diabetes or hypertension, consuming ginger might cause your levels to dip too low. Also, if you're on heart medications, particularly calcium channel blockers, ginger can potentially interfere, causing irregular heart rhythms or heart palpitations. It's important to remember that while ginger has numerous health benefits, it's not always a one-size-fits-all remedy. Always check with your doctor if you're on medication and considering adding ginger to your diet. Next up at number 6, if you're underweight, ginger might not be in your best interest. As surprising as it may sound, this celebrated spice, renowned for its health benefits, could potentially exacerbate weight issues for those on the lower end of the scale. But why? Well, ginger is known for its appetite-suppressing properties. It can make you feel full, reducing your desire to eat. This is great news for those aiming to shed a few pounds. But for those struggling to gain weight, it's a different story. The appetite suppression could mean fewer calories consumed, making it even harder to put on those much-needed pounds. It's important to remember we're talking about a balance here. Ginger, like many things, can be both beneficial and detrimental depending on the circumstances. So, if you're underweight, it's best to consult a healthcare professional before incorporating ginger into your diet. Number 8. Pregnancy is a special condition where ginger usage should be monitored. When a woman is expecting a child, her body undergoes a myriad of changes, all in the service of nurturing the new life within. In this delicate period, even something as common as ginger could have potential implications. Many pregnant women swear by ginger's ability to alleviate morning sickness, a common symptom during the first trimester. Research studies support this claim, showing a significant reduction in nausea and vomiting among pregnant women who consumed ginger. But here's the catch, it's not all sunshine and rainbows. While ginger has proven beneficial for some, it's not a one-size-fits-all remedy. There's a concern that ginger might affect fetal sex hormones or even contribute to a slight increase in the risk of spontaneous abortion. However, these potential risks are based on animal studies, and the evidence in humans is limited and inconclusive. Another point to consider is the dosage. Consuming ginger in large amounts could potentially increase the risk of bleeding. This is particularly relevant during pregnancy as it could lead to serious complications like premature labor or miscarriage. It's important to remember that even natural remedies can be harmful if not used correctly. So, should pregnant women steer clear of ginger altogether? Not necessarily. A moderate amount as part of a balanced diet or as recommended by a healthcare provider could be beneficial. But as with any other supplement or dietary change during pregnancy, it's imperative to consult a healthcare provider before consuming ginger. Pregnancy is a beautiful journey, filled with joy, anticipation, and sometimes a touch of morning sickness. Ginger, with its soothing properties, might seem like an easy solution. But remember, it's not just about you anymore. Every choice you make, every morsel you eat could impact the little life growing within you. Last but not least, let's talk about low blood pressure and surgery. The potent properties of ginger that we often celebrate can, in certain scenarios, become a cause for concern. One such scenario is when an individual has low blood pressure, also known as hypertension. You see, ginger has the ability to lower blood pressure, which can be a boon for those battling hypertension. However, for those already dealing with low blood pressure, consuming ginger could potentially exacerbate their condition. This is because ginger acts as a vasodilator, meaning it expands the blood vessels, thereby reducing blood pressure further. It's a bit like deflating a balloon that's already losing air. But why is low blood pressure a worry? While it's less talked about than high blood pressure, hypertension can lead to dizziness, fainting, and in severe cases, it can deprive the body's vital organs of the necessary oxygen and nutrients they need to function, leading to a potential health crisis. Now let's shift our focus to surgery. Whether it's a minor procedure or a major operation, surgery usually involves some form of blood loss. Here's where ginger's other property comes into play. Ginger is known to have antiplatelet effects, meaning it can prevent blood from clotting as quickly as it normally would. While this can be beneficial in preventing blood clots, it's not ideal when you're about to go under the knife. You see, slower clotting means increased bleeding, and during a surgical procedure, that's the last thing you want. That's why doctors often advise patients to avoid foods and supplements with antiplatelet effects, including ginger, in the weeks leading up to surgery. So, while ginger is often hailed as a super spice, it's important to remember that it's not for everyone. If you have low blood pressure or an upcoming surgery, it's crucial to consult with your healthcare provider before consuming ginger. Because as we've learned, when it comes to health, one size does not fit all. Low blood pressure or an upcoming surgery, ginger might not be the best choice. While ginger is a versatile and healthy spice, there are situations where it should be avoided. Ginger has a celebrated reputation worldwide for its many health benefits, particularly in easing digestive troubles and reducing nausea. But as we've seen, it can be a double-edged sword. Each situation is unique, and it's crucial to understand these risks. This knowledge can be a lifesaver, helping you make the right choices and safeguarding your well-being. Type yes in the comments below if you found this video helpful. Don't forget to hit the like button and subscribe to our channel for more informative videos like this one. We provide research-backed health content every day. While you're here, check out our other videos as well. Until next time, stay healthy.